Hello, this is Kimberly Sievers, and I'm going to be doing a head assessment and an ear and mouth and nose assessment on my patient. I have her seated here. I have ensured that privacy has taken place. I have performed hand hygiene. And the first thing I'm doing when she's sitting here is I'm looking at her from head to toe. I noticed that it is warm outside and she's in the correct clothing. She has on shorts and a t-shirt. She's very clean. She doesn't look like she has any cuts and bruises. Looks like she's very taken care of. So the first thing I'm going to do is take a little bit of my hand sanitizer, go around. I'm going to ask the patient her name. Just state your first name for privacy information.
Madison,
Okay, Madison, can you tell me what year it is?
2019.
Can you tell me where you're at?
My house,
Okay, and can you tell me who the president is?
Donald Trump.
Okay, Madison is very alert and oriented. Her skin color is very pink. She's warm. Everything looks like she's intact. Her mood is good and her speech is good. She seems to have no problems hearing. She's answering and her eye contact is fully on me. Her level of consciousness is great, and again, she's alert and oriented. The first thing that I'm going to do is inspect and palpate the back of her head and work my way up. I'm checking for lumps, any scrapes, any bruising. Have you had any headaches recently?
No, ma'am.
Okay. The head looks like it's fully fine. There's no abrasions. Everything's good. She's got full range of motion in her neck. Any pain when you go up and down?
No, ma'am.
Okay, take it back. Okay, her hair is up in a bun, but do you have any problems with your hair falling out? Any
No.
coldness? Okay. All right, so now I'm looking at her facial symmetry. Everything seems to be in perfect symmetry. There's no sloughing of one other smile forming. Everything is completely symmetrical. I'm going to palpate your temporal artery. Right and left sides are very symmetrical. Okay, now I'm going to check your sinuses. What I'm going to do is I'm going to push along this area and up in here. Do you have any pain?
No.
All right. So right now, kind of grit your teeth for me. I'm going to check for TMJ. Open your mouth. Close. Okay. Right now I'm going to go ahead and start with the eye portion of your test. I'm going to check each pupil to make sure that they dilate and constrict. I'm going to start with your right eye. Look straight at me. Constriction. Constriction. I'm also going to look at the back of the eye to see if I notice anything with her cornea, retina. Pink, looks very enough fluid. Oh, look straight at me. Okay, and everything looks like it's within the normal limits. I'm going to check her peripheral vision. What I'm going to do is you're going to look straight ahead of me and you just tell me how many fingers I have holding up over here.
2, 3,
Try again.
4.
Good. Okay, and then the cornea light reflex we've already done. We've checked for the peripheral vision. Next we're going to do the 6 cardinal gaze. What you're going to do is look straight at me and you're only going to use your eyes to find it. Okay, the way that we're going to go is we're going to do the right upper, the left lower, left upper, right lower, and then left to right. Okay, and follow me. Looks like everything is intact there. Now what I want you to do is, if we had a Snellen chart, if I was testing her for her vision with the Snellen chart, the main key is for her to be exactly 20 feet away. So we would want to make sure that from where she was standing to the chart that starts with the big E with the numbers down to on both sides, that she's directly 20 feet away. Next I'm going to do the ear. I'm going to check her ears. I'm inspecting the outside of both ears to make sure there's no abrasion, no drainage. Have you had any ear pain lately?
No, ma'am.
Okay. Normal eardrums will be like a shiny silvery, look like a little bubble, but very clear, and it will kind of like, it will be such a bright that it kind of reflects off. I can see the eardrum is completely shiny, but she does have a small amount of obstruction with some earwax. Same with this ear. I'm having to look a little bit harder due to the restriction from earwax, but I do see that they are completely normal. Now I'm going to do a whisper test. I'm going to stand behind you. I want you to take your left hand, put one finger in your left ear. I'm going to say a two-syllable word, and I want you to repeat it back to me.
Apple.
Next over here. Same over here. Drumstick.
Drumstick.
Very good. Patient does pass the whisper test. Next, we're going to check her nose. I'm going to look for any inflammation. Patient does tell me that she has a history of allergies. No drainage. Little inflamed, some redness. Looks like she's got some dryness from some old nosebleeds. But other than that, everything looks pretty normal. Septum looks good. Next, I'm going to check your mouth. If you can smile for me. Okay. And open up wide. I'm going to check your teeth and your gums. Stick your tongue out. Say ah. Patient's tonsil is a grade 1. Okay, put your tongue on the roof of your mouth. Lay it on the down. Okay. All right, next I'm going to do is her gag flex. Gag reflex was intact when she said ah, and she stuck out her tongue. Everything looked good. Next I'm going to inspect her neck. Everything looks symmetrical. As we did in the beginning of the assessment, her range of motion was very good. She has no pain. Tuck your chin to your chest. Very good. Okay, now I'm going to be checking for your lymph nodes. And while I'm here, I'm just going to check for her carotid pulse on both sides. Carotid is both present on the bilaterally. Range of motion's good, muscle strength is good. And the last thing I'm going to do for our patient is check her thyroid. So I'm going to go behind her. And can you swallow, please? Okay, real quick, can you swallow again? Okay, this concludes the assessment of my patient, Miss Madison. And again, I want to thank you for being a great patient.